this is a human tissue, a homograft going now to shape it. Homograft again, fascia, a human tissue again. Open this for me. Is the glue ready? Tissue glue ready. And we get now tissue glue. Tissue glue there. And we get our graft. And we'll fix it there in the middle for a few seconds. Just reshape it slightly. Again, give me sharp scissors. Just we don't like to have any thickness there, otherwise it will show there. Again, no much thickness. Now we get our bin, and we cross hatch the graft this way. The first cross hatching longitudinal, give me the knife. So we go cross hatching the graft, and you see. And then the second cross hatching will be oblique. So we do and cross hatch the graft in an oblique way. So as long as the graft is stuck to the fascia will form like a foundation and will prevent the mobility. The glue which we have done prevents the mobility of the graft. Again, we cross hatch the opposite way now, this way. So this will make the graft very flexible for you and bendable, able to bend, as you will see now at the end. So when you make it like this, so the graft will take the shape of the dorsum, and it will write the dorsum. You see now what happened now. You see now the graft, how it's nicely open as you have a tiles on the wall or tiles on the floor, but the floor is curved. So this small tile is there. It will take the shape of the dorsum, and it will curve nicely on the dorsum. And to write the dorsum, so it will reduce significantly the demarcation, the showing the graft, and also significantly reduce the mobility and the warping, mainly the warping of the graft, because the graft would now less possible to warp because of this cross hatching. You see, mainly the longitudinal cross hatching which we made at the beginning of the procedure. Give me knife again. The longitudinal cross hatching here, this will make the graft difficult to warp when you see the graft like this coming nicely like this down. So it will be riding the dorsum nicely, you see, all the way through. So extremely good technique. It's my technique actually. I'm the one who first has done and presented this technique with my video at Bizrah Rhinoplasty Bizrah School. So hopefully it will be of a great benefit to the surgeon in the world using this technique. So now we'll rub it now, and we will suture it. This will increase the bulk of the graft slightly. Also, this fascia will keep the graft stuck inside the bucket. So we make a bucket the exact size of the graft. So the bucket will be the exact, so that this will significantly reduce the floating and the mobility of the graft. Even if the fascia be absorbed after a few months, the graft will be already have healed in the midline. So that's a great advantage of this technique, the nice and the good preparation of the dorsal graft in order to reduce the warping of the graft and also make the graft to sit nicely on the dorsum, like riding the dorsum. So it will take the shape of the dorsum, call it like the tiling technique, the small tiles technique, or the mosaic tiles technique, sharp scissors. And now we soak the graft in iodine with Ciprobe antibiotic. Ciprofloxacin is the iodine is the antibiotics. You see? And we shut the graft. There, leave it there. Is the end of the procedure. Okay, there. The first rule is to make an exact pocket. Second rule is to elevate the periosteum. With periosteum elevated over the bone. Exactly, you see with your finger holding there. Don't go too much lateral, stay in the midline. Moving the periosteum, this will help the graft to heal with the bone and stabilize. It will reduce the possibility of floating of the graft. It will be sometimes, and then now we just go there. So you see now, it's extremely nice. It's in place, exactly in place, and it's riding the doors. I just press it with my, when I press it now, so it will open better. The graft will open nicely. It will ride more the dorsum. You see, look at the nice shape now. Look at the nice shape from the side. And look at the nice shape from the top also. You see how the nice is exactly riding, how the graft is riding the dorsum in a very nice way. We cross hatch the graft. I split first in the midline all the way through, longitudinal split, and then cross hatching, which really give extreme shape to the nose. Now with the, of course, the dorsum, like this. So the graft is not sitting like this. The graft is, it's a dorsum. So the graft is sitting like this now, because we scored the graft all the way through. Which is that's the beauty of this technique, that the graft is riding on the dorsum. It's not sitting like this. So if you sit like this, it will work, go down there, it will work, or become deviated. Now with this technique, what we scored, the graft is sitting like this, it's riding the dorsum. This is the case of the sudden nose, which we use the homograft, rib homograft, and we did cross hatching of the graft as you have seen in the video. And you see the big difference between now, before and after, really. It's extremely very nice results. And we did the cross hatching of the graft there, so you cannot see any edge of the graft. It looks quite natural and no demarcation as you see now. Extremely nice profile, nice projection, nice dorsum projection, nice tip projection, nice base, and very nice profile and tip projection and dorsal projection. It's really an excellent technique. Operation lasted about maybe 40 minutes only, and you see this excellent result. This is Bizrah from our center. Thank you.